The integrated acute care scenario will assess your ability to do several things, namely, perform a rapid focused history, recognise the severity of illness and escalate care early. You need to perform a structured A-to-E assessment and institute life-saving treatment. You need to manage your tasks appropriately, prescribe accurately and timely, ask for and interpret investigations, and finally, make a rational differential diagnosis and management plan. At the start of the station, when the buzzer goes, you will enter the room and the examiners will check that they have the right student. As you will notice, there will be 2 examiners and a nurse in the room. The examiners will explain the roles that each of them will have in the forthcoming assessment. One examiner will play the voice of the patient. The other examiner will be the person that you will interact with when and if you require help. Your main interaction will be with the nurse. Once the introductions have been made and you know the role of everyone in the room, the examiner will give you a brief synopsis of the patient that you will need to assess. They will check your understanding and then you will commence your assessment of the patient. It is important that you direct all your questioning to the mannequin as if it was a real patient. And as previously discussed, one of the examiners will be the patient voice. The nurse is able to perform all tasks that you require. However, you do need to ask the nurse to do any investigations for you. If you are struggling or the nurse thinks you are spending too much time gaining a history, she or he will encourage you to move on by giving you relevant hints. For example, this patient looks very unwell, or I'm very concerned about them. The nurse will do all the OBS as stated. However, you need to check these, as the nurse will not tell you that your blood pressure is low.
Hi, can I just check your name?
Yes, Val McDowell.
Hi Val, I'm Alistair and this is Fiona. We're your assessors for the station, and this is Barbara and she's going to be your nurse that's going to help you through.
Okay.
I'm going to read you through the scenario and then I'll ask you just to repeat it back to me to make sure that you've got it, okay? So this is Carla Jones. Carla's 25 and she's been referred from the acute admissions unit with shortness of breath. You're an FY1 on the unit and have been sent to assess her and institute initial investigations and management. There's an admission unit nurse with the patient who can perform appropriate tasks if you ask her.
Okay.
Okay, do you want to repeat that back to me just now?
So it's Carla Jones, she's 25 and she's come into combined assessment?
Yeah, the admissions unit.
With shortness of breath. How long has she had that for?
So that Carla will be able to tell you.
Oh, right, okay, sorry. I'm the FY1 and I have just to go and see her and Barbara will help me out with any obs or anything.
Yeah, that's right.
Do. Okay.
Okay, do you want to see to Carla for me just now?
Hello, Carla. Hi, Carla. My name's Val. I'm one of the doctors here. Can you tell me how you're feeling?
Really short of breath.
Yeah, you look as if you're struggling a wee bit there. Barbara, could I possibly have a SATS pro bono,
Okay,
please? Carla, have you ever had anything like this before?
Asthma.
You've got asthma, and are you on any medicines for that?
Inhalers.
What?
The blue and the brown one.
A blue and a brown one, okay.
So that's coming up at 92, 93.
Okay, that's not so good. Barb, can you put on some high flow oxygen 15 litres
Okay.
with a non-rebreathe
Okay.
mask? Thanks, do.
Yeah, you need to prescribe that for me.
And could you do me a favour, once you've done that, could you just check her respiratory rate and her pulse and blood pressure for me, if that's
Yep.
okay? Right.
If you wish the patient to have oxygen, you may ask the nurse to place an oxygen mask on the patient. Please be advised that she will ask you to prescribe oxygen on the chart.
Right, Babs, that's it prescribed now. What was her respiratory rate? I mean, it looks quite fast.
Okay, it's at 25.
25, okay.
The pulse is 122.
Thank you.
Quite
Have you
fast.
got a stethoscope and you can just have a listen to her chest, please?
To ensure continuity with the scenario, the nurse will give you all the OBS and any clinical information as the scenario unfolds. For example, if you wish to listen to the patient's chest or check heart sounds, the nurse will advise you of what you can hear.
There's widespread wheeze throughout when you're listening.
Okay. Okay, so her just chest expansion.
It's symmetrical.
Is it shallow or
Shallow.
and any accessory muscles?
Yeah, just using chronometer.
Okay. She's very wheezy in her chest.
Yeah.
So I think I'll prescribe her some salbutamol.
If you wish to prescribe medication for the patient, please ask the nurse to give these medicines. However, you will need to prescribe them as you would do in a clinical area. If you struggle with the prescription, you may check the BNF. You don't have to, but if you are in any doubt about the drugs or the dose you're given, you're strongly advised to check this before continuing. If your prescription is wrong, the nurse will query this with you, as any nurse would in a clinical area.
I'm not going to do a peak flow because she can barely speak
Yes.
to me. Carla, are you allergic to any medicines that you know of?
No, I don't think so.
Okay, and have you've been taking your nebulizers at home? Has that got any better? Have they helped?
Just the puffers.
Okay, have they helped at all?
Not today.
Not today. Okay. So 5 milligrams of salbutamol and
Okay.
500 micrograms of ipratropium,
Okay.
please. And we'll just drive it through oxygen because she's quite hypoxic anyway.
You're prescribing that, yeah?
I will do. And would you be able to get me a gas as well?
Yeah, I'll do
please?
that. Blood pressure's 107 on 57.
Okay. Carla, sorry, are you allergic to anything? Did I ask that?
Yes. No. Okay, Carla, I'm just going to do. Check. I'll let you BG. Just going to check your oxygen levels. Okay, sharp scratch. That's it done. Okay, that's just off analysing just now.
Perfect, thank you. So that's her salbutamol and her ipratropium.
Okay.
Ladies. So, having a wee think out loud. Queasy, actually. How does she feel, Bugs?
She's really quite cool.
She's quite cool.
Okay, I'm just going to switch over masks. Okay, you're going to get your salbutamol through a nebulizer this time. Okay.
Carla, have you ever been in hospital before with your asthma? Okay, and we just admitted to a ward or? Okay. Gas back in?
There may be some test results available if you've requested some investigations. It would be a good idea to verbalise these results with the nurse. However, if you don't do this, the nurse may ask you what your results show. For example, please can you tell me what the ECG shows, or what do those blood gases show?
Okay, so right, she's quite hypoxic. She's got PO2 of 8. Was this on the 15 litres?
Yeah.
And her CO2 is 4.7, which isn't great considering she's got a respiratory of 25, 26. Babs, I'm going to phone for some help
Okay.
now because I don't think I can look after her
Okay.
very well. would you be able to do me a favour? Could you put in a cannula, please?
Yes.
And apart from your asthma, Carla, do you have any other medical problems? No. Okay. And are you on any other medicines apart from your puffers? No. Could I have a full blood count, a U's and E's, and a glucose, please?
Okay.
And I think, given the fact that she's, her blood pressure's, it's okay for someone her age, but the fact that she's asthmatic and breathing so fast, she's been unwell, I'll maybe give some fluids, but I'll prescribe that once you've got the cannula.
Okay.
I'm going to phone for help
Okay.
first.
I'll get the cannula.
To my registrar, medical reg.
When you decide that you need to call for help, you should state who you want to call. Please remember to try and structure your call. Make it timely and relevant, and take your time to explain to the examiner who you are and why you're phoning. Are you phoning for help, or are you just phoning for some advice? Tell them where you are and give them a brief summary of the patient. Should you decide to phone for help relatively quickly in your scenario, it may be that the examiner is not able as your help to come at that point, and they will advise you of this.
Okay, so do you want to speak to me as if you're phoning the medical registrar just now? So, hi, it's Alistair, I'm the medical registrar on today. Okay.
Hi, my name's Val. I'm one of the FY1s in the assessment unit. I'm phoning for some help, please. I have a 25-year-old lady who's just been admitted with shortness of breath. She's known to be asthmatic, and she's coming in. She's tachypneic. She's got widespread wheeze, and her PO2 on 15, which is oxygen, is 8, but her PCO2 is 4.7.
Okay.
So I've given her some nebulizers, and I'm just really concerned that she's not very well. Would you be able to?
Yeah, she doesn't sound very well at all. I'll be about 5 minutes or so. Is that okay to come and see her?
Okay.
Right, so if you wouldn't mind just continuing to look after her just now, and I'll be down as soon as I can.
Okay.
Okay.
Thanks. It's about Reggie's coming in about 5 minutes.
Okay.
So
I've got the cannula in.
perfect. I'll order. Can we maybe get a portable chest X-ray?
Okay.
And an ECG might be
Okay.
quite good as well. And I'll just prescribe her 500 mils of saline.
Okay,
We just get that running through as soon as.
Okay, right.
There may be some relevant patient information available. This may be in the form of a GP letter, a ward continuation sheet, or perhaps even an A&E form. This will be freely available, but won't be pointed out to you unless you're struggling with the scenario.
This is her GP letter.
Yeah, that's it.
Okay. I'm trying to find it. Are those nebulizers helping at all?
No.
Okay. I've asked one of my senior doctors to come and have a wee look at you just now. Okay, so hopefully we'll get that sorted out. 2 ICU admissions in the past and recent course of steroids. Carla, did the steroids help at all?
Don't think so.
Okay. Perhaps I might give her some IV hydrocortisone,
Okay.
and I'll give her IV because she's struggling to talk. She doesn't look very well there. So I'll give her 200 milligrams of hydrocortisone.
Okay.
If I prescribe that, would you be able to pop some just cardiac monitoring on, and maybe give me a capillary refill time, please? The GP says she's been unwell. Can I maybe get a temperature on her as well?
That's fine.
Thank you.
Again, when you're filling in prescriptions, make sure your prescription chart is filled out appropriately with all the relevant boxes filled in. The most obvious one would be to check for allergies. Your prescription should be legible. If there are any issues, the nurse will query this with you.
So, okay, so I'm just going to recap.
36.5.
36.5. So, airways fine. Breathing I'm really concerned about. Sats are still
Flat 92.
92. We've given her some salbutamol and some ibuprofen, and that's still going. We can always give her some more salbutamol
Okay.
and do that back to back. I think that's where the issue is. Circulatory wise, she still feels
Oh yeah, I'll just
quite
check her. I'm
cold.
just going to, a wee bit of pressure on your chest. 5 seconds.
5
I'll leave you to
seconds,
know.
and she feels cold anyway. And blood pressure, maybe get another blood pressure for
Okay,
me as
yeah.
well, but I mean we can maybe after that fluids run through and see if it's helped. Disability, she's eyes are closed now, I'm only really speaking, she can't speak in sentences, so I'm really concerned about her. Did I ask for BM?
I did one, yes. It
Oh,
was
thank you.
4.8.
And I've got a temperature as well. I mean, one final thing, I'll maybe just have a look to see if I'm missing anything. Carla, I'm just going to have a wee look at your legs here and your tummy just to make sure there's no rashes or anything. And any pain in your calves there at all?
No.
Okay, so calves make me feel nice and soft. And any pain in your tummy?
No.
Okay, so E, I think, is everything else. I've got that GP letter. I suppose we could get some notes from ICU, but I can't think of anything else.
Finally, when you've finished your assessment, the examiner will come as your help at this point. They may prompt you to tell them what has happened and ask some additional questions to assess your understanding of the patient's condition. They will ask you if you have a differential diagnosis and what additional treatments or help may be required. They will then advise you that the station has finished.
Okay, so at this point your senior help has arrived. So, hi Val, I'm Alistair, I'm the medical registrar on
Hi.
today. Is this Carla that you told me about?
Yes.
Okay.
So, obviously I told you on the phone that, well, she's an asthmatic. She's come in, she's been unwell for the past few days, and she's come in with increasing shortness of breath. I've given her some salbutamol and some ipratropium nebulizers, but it doesn't seem to be making any difference at the moment.
Okay.
I've also, GP's given her a recent course of steroids. I've given her 200 milligrams of IV hydrocortisone, and we've got some fluid running just now. Cardiovascularly, she's tachycardic and she's peripherally shut down.
Okay.
I'm just really concerned about her.
So what do you think's going on with her at the moment?
I think she's certainly having an exacerbation of her asthma.
Okay. And how severe do you think that is?
I think she's probably at the moment sitting on the kind of acute severe, but given the fact that she's had 2 ICU admissions in the past, I'm worried that she might end up kind of tipping over.
Do you think she needs to go to critical care at the moment?
I don't think it'll be far off, and I think certainly it would be helpful if they came to see her.
Yeah, that's fine. I can phone them and and ask them to come and see her as well.
Okay.
Is there anything else that you could think about treating her with at the moment?
Certainly we could think about some aminophylline or some magnesium, but I'm not really sure of the doses of those.
Okay.
So.
Well, that's your station finished. Thank you very much and well done.
At this point, you may thank your help and leave the room. The examiners will then independently grade you and complete the mark sheet with comments.